Welcome back to another edition of Higher Education Today. I'm your host, Stephen Roy Goodman. I'm here in Hargeisa, Somaliland, where we're going to be speaking about healthcare, and in particular, I'm at the Edna Adan Hospital, and I'm here with the founder of the hospital, Edna Adan, who happens to be the former foreign minister of Somaliland. Welcome.
Thank you very much. Thank you for being here.
Well, thank you for having us. And maybe if you could say a word or two, you're a kind of an unusual person because you're a historical figure, but you're also a trained midwife, and you're the person who founded and runs this very large hospital here in Hargeisa.
Well, I think necessity is makes decision for us. And yes, I am a nurse, I'm a midwife. I grew up around the world, trained by many people in many countries. And then, of course, when my country was in its moment of need, I found out that the only way I could contribute towards the recovery of my people and my country was to share the knowledge that the world had given me in nursing and midwifery and healthcare to help my people. And of course, one person cannot do much. I focused on training as many health professionals as possible in nursing and midwifery and lab and whatever, so that our people would benefit from the care given by health professionals who are trained as best as we could under international standards. And so this is what brought me to Somaliland and to do this.
But it's interesting, you know, so many people do that on a political level, but you've decided to do it in terms of healthcare.
In fact, it's something I've wanted to do since I was a child, because my father was the first doctor in my country, and I've always wanted to do that. When I would do it, how I would do it. It was a child's dream to do that. But then when my country sustained so much difficulties, underwent so much war and post-war recovery, that was when I felt that what I had wanted to do all my life, and what I had prepared myself for all my life, was exactly to do what I am doing now. Help the recovery of my country, Somaliland. This was the best way I could help. And I've been very blessed.
Well, it sounds like you're doing a terrific job here, and I understand that we're going to be meeting a number of people who work at the hospital, including a young woman who, if I understand this correctly, grew up in a refugee camp and is now the head of surgery here. Did I get that right?
A very competent surgeon, among the top surgeons in my country, Somaliland.
But before we speak to that surgeon, if I can just ask you one more question about the structure of this hospital and kind of how it's structured.
Well, the idea was for me to build a maternity hospital. I'm a midwife, I love babies, that's what I had been teaching with the United Nations, and a long career with WHO. But then a hospital is a hospital. We have equipment that can take care of men as well as women. We have the competence to treat a sick child, an old man, an old woman. So the hospital has become a general hospital. We are now a referral hospital. We are a teaching hospital. We set standards. We have several workshops going on right now. Somebody is training a group of people from different hospitals, teaching them how to take care of trauma patients, how to do suturing safely. There's another workshop going on in the hospital, teaching health professionals how to take care of patients with mental health issues. So we have orthopedic surgeons that fix broken bones. We have dentists who take care of maxillofacial problems. So we are a general hospital, and we just try to do whatever we can and whatever we do to the best of our abilities. And that's how we set standards. That's how we're licensed by the government of Somaliland. That's how we partner with other institutions of learning around the world. I can mention Harvard, I can mention King's College in the UK, who send us interns, who send us professors to help us teach. I can help, say, the University of Pennsylvania, that has awarded me 1 or 2 awards. We partner with the world, we learn from the world, and the world comes to learn from us too, to see what we're doing and how we are doing it under very difficult circumstances at times with very limited resources.
Well, continued good luck. Thank you for having us here.
Thank you.
Thank you. Thank you. Thank you very much. We're continuing our discussion with Shukri Dahir, who is the head of surgery here at the Edna Adan Hospital. And my understanding is that you've had an incredible background. Would you mind saying a word or two about your background before you became the head of surgery here?
Yeah, so I was born in Hargeisa just a few years before the Civil War. And then when the Civil War happened, my family went to Ethiopia, and we were in the refugee camp in Ethiopia. And then we came back, thankfully, to our country, Somaliland. I started studying in Hargeisa. So when I was in the school, I always, in my mind, liked to become a health care provider. I didn't know which type, like with a nurse or midwife or a doctor, but just a health care provider. So when I was in school, and Edna, the owner of the hospital and the founder, and announced that she will train nurses and midwives for the country. So my mom was interested to apply for me, because at that time I didn't have any skills to apply for. And so with the help of other friends, they wrote me a little bit of CV or something. And then I applied, and I entered the exam. And I wasn't expecting that I will become the third person in all 300 people who applied. And then I finished my 3-year program of nursing. And then I finished 9 months post-basic midwifery. So, and also at that time, interested to train female doctors, because we didn't have any female doctors. And our women were always ashamed to share their problems with the male doctors. So she said, I will train 2 more doctors for the country. And I got a sponsorship from Edna Hospital through Edna Friends. And then I went to Goodman, and I finished my MBBS, general medical doctor. And then thankfully I got another program to join my general surgery program, and I'm now the head of the surgical department.
That's a great story. Yeah. And if you wouldn't mind saying a word or two, my understanding is you did some of your training in Florida as well. Is that, did I get that right?
Yes, so when I was in the surgical training program, I attended a conference together with Dr. Edna in Washington, D.C. in end of 2016. So I met at that time a surgeon from my clinic in Florida. And he said, I can sponsor you for 2 months so you can brush a bit more of your surgical skills. And then you can watch and become one of our observership members at that year. So I went back to US in 2017. And I have been to my clinic in Jacksonville for 2 months.
Since you spent some time in Florida, is there anything that an American viewer might not understand about how surgery might be different here in Somaliland than it is in the US?
Absolutely. So here, because there is the surgical supplies are extremely different than compared in Somaliland to US. Everything here we reuse it. And everything you use in US is single use. So it was a shock to me to see that throwing away a lot of usable things that we're reusing here, that is thrown away in single use. The other thing, people, because they have a good training and they are getting some specializations, every kind of surgery they are doing, they have a plenty of people who are their supporters, and then they can call in whenever they have a difficult case. But here we have a limited trained personnel, so you are on your own, and it is a lot of stressful when you are operating with a few people around you. So that was also a huge difference when I went there. And there was a huge simulation room that you can practice before you finish the surgery. And that's what we are lacking in the country as well.
But now I understand you have some equipment here.
Absolutely, thank God. So we have now supplies that we get. We bought some of it, and we got some donations, and our current students are lucky to have those things to practice on it. And they have more skills now when they graduate than compared to years before. Yeah.
Well, thank you very much for sharing all this today. We're continuing our discussion about training here at the hospital, and I've got two students with me, one of whom is an expert in midwifery and one of whom is a budding expert in nursing. Welcome.
Thank you.
Well, maybe if you guys could talk a little bit about what the training involves. So if we can start with you in terms of midwifery. What exactly are you training and how are you training?
So when we first come here, we go through an extensive 4-year training program where we start off at the basic levels, where we are taught how exactly you're supposed to care for a pregnant woman and how exactly that would help the economy here in Hargeisa and many areas in Somaliland. So at the start, we start learning exactly how to like the basic embryology. We go through a lot of exactly how the baby grows inside the mother's stomach. We start learning exactly all the complications of the common complications that happen here in Hargeisa in Somaliland, and we start learning exactly how to combat those complications and how to better help the women's health and the newborn's health, as there's a lot of mortality rates with both newborns and mothers. So it's been very fun so far. So can't wait to exactly try to apply all these skills that we've learnt into the real world.
Well, can we get to today, though, before we even get to the outside world? So when you're doing the training, what are some hiccups in the training? What are some things that are very common problems that you encounter that you're learning how to overcome?
Common hiccups we have in training is like there could be a few communication problems with the mother, as she could not understand anything about her health. So we have to find common ground where we have to teach her exactly what is wrong with her health and how she can improve to help herself and her newborn.
And in fact, if I can do a follow-up to that, my understanding is that there are a number of traditional healers here in Somaliland. How do you interact with them, or do you interact at all?
So I personally never had any interaction with any traditional healers, but there are many, especially in the rural areas, where they try to deliver a baby, and they may not know much about a woman's health except for any traditional or religious stuff they might know. And one of the common ones where they think is very good for a mother and a newborn is FGM, where it's called female genital mutilation, where they think it's good for the community, where every young woman has to be genitally mutilated. But we are going through a lot of training where we have to teach mothers specifically to not continue that cycle with their newborns.
And in terms of the nursing aspect of this, how do you play off of what we just heard a second ago?
I don't know if you knew about that, Steve, but here in Somaliland, we don't have an emergency line where you can call 999, hello, I need an emergency, and I need a healthcare worker. But here in Edna Adan, we are trained to be a paramedics, we are trained to be a nurse, we are trained to be also a midwives. So we are all in one. So our training sessions are very tense. They are like multiple aspects of the healthcare. So we are trained to be all in one, to be honest.
Well, that's a really interesting point, because I suppose when you're in an emergency situation, you're the team.
You are the team. In fact, that is very true. You are the respiratory therapist. You are sometimes the runner. You are the circulator. You are a lot of personnel that could help you, but it's all in you, because you have been trained by Edna Adan University, which is in fact one of the few, if not the only, university that have its own teaching hospital. So that's what helped us to be such a confident and a strong nurse.
And I suppose if I could ask you one follow-up to that is, let's say you're in an emergency situation and you don't have the resources you need.
Yeah.
What do you do in that situation?
That's a very tricky question. It depends on the situation. We have been trained to work with a very limited resource, even though we have a lot of training, like equipment as seen behind you. But in matter of fact, in the street where there is nothing like this, where you don't have a defibrillator, where you don't have a pulse oximeter, we are taught to use a clinical expertise by checking by our hands, by seeing in our eyes. We use the power of our knowledge, our own skills. We don't much depend on the external, which we would love to, but since we don't have it now, we use our experience that have been taught to us by the supervisors in here.
Well, so thank you both very much. Continue the good work. You guys are doing a great job. As you can see, we are now in the lab talking with Nimo, who's a senior student and a specialist in lab work. Welcome.
And welcome to our clinical lab. And we do here a lot of work. We work in 24 hours, in day and night. We get samples from our patient, outpatient and other hospitals in our city and some outside the city. So we do different, we have all departments like hematology, parasitology, and chemistry, as well as blood banking. We run a lot of work in daily and night. Also we have quality control. So we do a lot of work. We are the silence behind the scene.
Well, that's interesting. Well, speaking of being the silence behind the scene and the quality control, how do you make sure that something is what it says? Like, how do you know that something is really clean?
So we do as a daily or weekly, as routinely, we do as quality control, make sure the machines are working well and this results is accurate or not. We make sure as routinely.
And so what happens if a machine isn't working? Does it go to a specific place or do you fix it yourself?
It depends on the condition. Sometimes it is changeable, like reagents and like machine parts. So it depends on what's wrong with the machine.
All right. And is there anything about this lab that, as someone who's not a doctor and not a technician, I just go to the doctor sometimes and get my blood taken. Okay. Is there something that as a patient I should know about this lab that perhaps I didn't ask you?
You should know, and it's where your sample came when you get tested from. It's where the results are taken and diagnosed.
And you want to make sure that it's an accurate result?
100%.
Well, 100% thank you for your time today.
Okay, you're welcome.
Thank you. Thank you very much. Hello, we're continuing our discussion at the hospital. I'm with Nuura here, who, as you can see, we're in an operating room. And Nuura, you run this place, right? In terms of the operating room. Can you say a word or two about this?
Yeah, I'm Nuura. I'm OT in charge in Edna. Here we have like 4 OTs. So we are operating here like several operations, like gynecologist operations, hysterectomies, general surgeries, pediatric surgeries, like shunts, VB shunts, spinal bifides. So this is kids OR. So we have here like some machines.
What is this machine?
This is anesthesia machine. Also we have CR machine. Sometimes we are using like orthopedic cases. Here we have also anesthetic machine, another anesthesia machine, laparoscopic machine. We need to start like this week for the operations. So all the operations we done here, sometimes we are get help like American doctors. They come from America. Sometimes they come from Kichab Hospital. And we can get like training for the outside in Hargeisa, in Somaliland, like Taiwan, Ethiopia, Kenya. Sometimes we can get like some doctors, they come from another countries, then they come here to train us.
We're continuing our discussion at the hospital with a slight different twist now. We're with the head of the dental school. Mahdi, welcome.
Thank you, Steve. Glad to be here.
Well, I'm glad that we're actually talking and I'm not on your chair. Just for the record, I get my teeth cleaned 4 times a year because I have very weak gums.
You have 4 times as good as anybody else who's healthy.
Well, thank you. And I'm so glad we're just having a conversation today.
No problem.
So if we can talk about the work that you do here. You're the dean of the school. There's all sorts of equipment behind you, but before we explain the equipment, maybe if you can talk about what kind of training you do for students and how students learn to be dentists.
Wonderful. Yes, dentistry is a very expensive endeavor. It requires a lot of skills and a lot of equipment and material and all that stuff. And we were lucky enough to have support from obviously Edna and her friends and many donors that are available for her in terms of resources and things of that nature. So we were able to acquire the basic necessity in terms of the dental technology department and in terms of the dental clinicians and chairs and machines and sterilizers and all the necessary equipment you need to train. We also have the right teachers in terms of getting them to do the basic protocols initially and then advancing to using models and graduating from that to seeing patients and learning how to do examinations and eventually do extractions and fillings and all the necessary steps before they can graduate. So they have a logbook that's about the yay thick, and in terms of for them in order to graduate they have to have about 80 or 90 extractions, and they have to go out into the countryside to be able to service a population that has no access to dental care, and that's what we do.
That's an interesting point. So I suppose in the rural areas, you have to go to them. They can't come, they have no way of getting to you.
That's exactly what we do. Twice a year we do that. We have to find the patient at where they are. And there's a lot of lack of education in terms of dental hygiene and follow-up and resources, basically. So what you need to do is provide what you can, when we do. It's beneficial for our students because they get to practice and be able to deliver the services, and also they serve a population that's really in need for that kind of service in terms of of dental care and health, because dentistry is really important for everyone, because that's everything that goes through you has to go through your mouth, and if that's not working properly, then it creates a cascade of different issues for the patient. So we are very pleased that we can actually do that for our people in terms of that.
Well, and I appreciate that. We were in Gedeble, and it took about 2 hours to get there, and the roads were quite difficult. And so you can imagine that the person who doesn't have a car, how are they going to come to a clinic like this?
They don't. We go there.
Yeah, I get it.
Yeah.
Well, and if we could do a little show and tell, there are all these things behind us.
Right.
What are these?
Well, this basically we're in the dental laboratory department right now, and this is the machine behind me is a polisher. So this is what we use to polish dentures and partials and even crowns in terms of when we do that, because our students are not only required to do the clinical aspect of dentistry, but they're also required to do the dental laboratory aspect of it, which means they have to pour models, they have to take impressions, they have to make crowns, they have to make bridges, they have to make dentures, they have to make partial dentures, the whole gamut. So we have the facility to actually accommodate, and we have an instructor that's actually whose entire job is to make sure that every student before they graduate have to do a number of appliances. We call them appliances, but whatever goes into your mouth in terms of what we make. So that's what we do here. So it's pretty much a field ecosystem. So it's synergy, going between the clinicians and the technicians, and basically dealing with the same patient at the same time. So that gives them a real life experience even before they go in the field and do what they need to do.
Well, speaking of going in the field, my understanding is you grew up in Virginia.
I did.
How'd you get to Somaliland?
I got to Somaliland back in 2013 also, and it was one of those things. I did what I needed to do in America. The American dream and all that's associated with it, to get an education, get a job, live in the suburbs and all that stuff, which is perfectly fine. America has definitely had a huge impact on me. It made me who I am in terms of, responsibility and being able to take care of yourself and, be able to have goals and vision and places to go. It's a very demanding society to grow within it, because it's basically singular in terms of what you do. Whether you succeed or not, you're on your own. And And I was also very much attached to my country, which was where I grew up and I knew, and that's where most of my people lived. And I was in two worlds at the same time. I never felt 100% American, even though I became a citizen. All my kids are born in the U.S. I married my wife in there. So for all practical purposes, I was as American as an apple pie. But then again, there was that part of me that was missing something. And I finally got to a point where I had to make a change, and I just came. And I had no plans. I just got on the plane and came here and moved with my wife and my 10-year-old son. And I was about a couple of months into being in Hargeisa, trying to find my bearings. I ran into somebody very important, Mama Edna Adan, and I've met her in the U.S. when she was a foreign minister. And I was able to carry her back for her when she goes to office and things of that nature. And she asked me what was I doing here, and I said I came back. And she said, what are you doing? I said nothing. I said nobody does nothing with around me. So she picked me up there, brought me here, and she said, do this, create a faculty of dentistry, because that's what you're here for. And it really was what gave meaning to my life. And from there on, I just had a purpose, and it was the best thing that I've ever done. It's sometimes life works itself out. It was great. I did not know that. I did not know I enjoyed teaching. I did not know that this is exactly what I wanted to do. But to see that and to see the results of what happens after you find someone who thinks the way you do, who gives you all the support that you need and the resources, it's amazing. We have graduated over 200 students out there, and almost 60% of the dentists in Hargeisa are those who graduated from here, and they are best trained.
Well, that is terrific. Well, thank you for sharing your time. Thank you for doing all this great work, especially in the rural areas.
That's wonderful. It's an honor to be here and be able to do that. It really is.
Well, thank you.
Thank you very much.
If you would like additional information about higher education today and have a note to send to me, please go ahead and do so by sending an email to highereducationtoday@topcolleges.com. And thank you for watching. We will continue to bring you quality discussions about matters in the university world, in the academic world, in Hargeisa, in Washington, D.C., and all around the world. And you've been watching Higher Education Today.